Hi, Market Physical of Eversville again, and I would like to address a question that gets asked a lot by the ladies, because as we all know, it's a woman's world, so we got to address those. So, one of the questions is, I like high heels, I like my shoes, and that's fine as long as you wear them in moderation, but I'd like you to consider a few things that what high heels can cause. So, first of all, we're meant to have our feet flat on the floor so the muscles, the joints are all balanced. But when you elevate your heel, especially some of the heels that I've seen that are like 6 inches tall, every mechanic or every joint in your body, mechanics changes. So when you come up on your heels, number one, your body wants to find a position of balance. So if you're up on your heels, that's no different than if you are walking up an incline, okay? So when you're doing that, your body's going to lean, so you can't walk around like this on heels, so your body then, to compensate, will arch their back more, to pull their shoulders back and get their head back up. They're going to be shortening the calf muscle because now you've got it in a shortened position, and your back is going to be overarched, which can put pressure on your lower back. Your hips are going to be tight because now you've tilted your pelvis forward, which is going to tighten your hip flexors. All these muscles then can become tight, can become painful. And then another consideration is if the toe box is very narrow, you're taking your toes and you're squishing them together, which is where they don't want to be, which can also lend itself to causing a bunion, which is here at this first joint, because you're pushing that in and you can be causing that to be stretched out towards the outside of your foot. So if you decide to wear high heels, wear them in moderation, but just consider that if you start having some problems or pains, you may want to not wear them as often. For further questions, contact Mark at physicalofeversville.com.